Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. Today is March 10th, 2011. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 23 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. Let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that the human body has the mechanisms in it to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Many of you have never experienced the power of naturopathic medicine and the unparalleled healing force of the human body. Since I began my practice in 1988, naturopathic medicine has literally helped thousands of my patients recover from the most severe and life-threatening diseases and many other chronic ailments that conventional medicine provided no answers for. On this television program, my patients share their courageous and inspirational stories with you. If I may say so myself, their stories of recovery are incredible, amazing, and heartwarming. I hope that their stories provide you an understanding of how naturopathic medicine can help harness the tremendous healing potential that God has instilled in the human body to heal itself. Please enjoy their stories. Our hope is that they inspire in you the hope that true health is attainable and you can have it when you are ready. Well, that's enough about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask the patient to share his or her experience with naturopathic medicine so that you can get a better understanding of how this safe and effective form of medicine works. Today's guest was first diagnosed with stage 3 colon cancer in November of 2006. Her course of treatment was an extremely radical and heavy combination of chemotherapy medications along with naturopathic medicine. What makes Linda's story so interesting and inspirational is not only the fact that she survived stage 3 colon cancer, but how the extremely toxic combination of chemotherapy medications produce innumerable, painful, and horrific side effects, and how naturopathic medicine helped her overcome them quickly. Stay tuned to hear Linda's inspirational story of not only beating the dreaded Big C, stage 3 colon cancer, but learn of all the horrifying side effects produced by her chemotherapy treatment. So with that being said, let me introduce our special guest, my patient Linda. Linda, welcome, and thank you for joining us on Island Wellness.
Thank you, Dr. Uchida, for asking me to, volunteer to be here.
My pleasure. So Linda, before you share your incredible journey of beating stage 3 colon cancer with us today, and overcoming the horrific side effects of chemotherapy with naturopathic medicine, let me read off some of the basic facts about colon cancer, or colorectal cancer. Colorectal cancer is one of the leading causes of cancer-related deaths in the United States. Almost all colon cancer starts in the lining of the colon and the rectum. There is no single cause for colon cancer. If you have a higher risk for colon cancer if you are older than 60 years of age, are African American or Eastern European descent, eat a diet high in red or processed meats, have cancer elsewhere in the body, have colorectal polyps, have inflammatory bowel disease like Crohn's disease or ulcerative colitis, have a family history of colon cancer, have a personal history of breast cancer. Common symptoms that may indicate colon cancer: abdominal tenderness in the lower abdomen, have blood in the stools, or you have chronic diarrhea or constipation or a change in your bowel habits, you have narrow stools, unexplained anemia, or weight loss of unknown origin. Tests that can diagnose or lead to the diagnosis of colon cancer are A rectal examination may reveal a mass in the rectum, but not in the colon. Fecal occult blood tests might find invisible blood to the naked eye in the stools. Colonoscopy or sigmoidoscopy may be able to visualize a colon cancer in the sigmoid colon or the colon. A blood test finding anemia. Other blood tests like CEA or CA19-9 test, or seeing it visually on CT scan or MRI scans of the abdomen, pelvic area, the chest, or the brain. Stages or degrees of colon cancer and the general 5-year survival rate with conventional medical treatment are: stage 0, very early cancer of the innermost layer of the intestines. There's a 98% 5-year survival rate. Stage 1 colorectal cancer or colon cancer. Cancer is in the inner layers of the colon, and there's a 90% 5-year survival rate. Stage 2 colorectal cancers. The cancer has spread through the muscle wall of the colon, and there's a 70% 5-year survival rate. Stage 3 colorectal cancers or colon cancers has spread through the muscle wall of the colon and has spread to at least one lymph node or several. And on average, there's a general 5-year survival rate of 50%. The stage 4 colon cancer, the cancer has spread to other organs, and the 5-year survival rate is 5%. Typical colon cancer treatments is surgery for stage 1s, 2, and 3 are common. Radiation therapy can be used on stage 1, 2, and 3, possibly 4. Chemotherapy can be used in stage 1, 2, 3, and 4. Stage 2 and 3, the typical chemotherapy treatment is 5-FU and leucovorin. The stage 4 colon cancers, typical chemotherapy treatments are irinotecan, aloxaplatin, 5-FU, Erbitux, Victibix, and Avastin, either used alone or in combination. All right, Linda, so when were you diagnosed with colon cancer?
I was diagnosed with colon cancer on November 9th, 2006.
All right, you remember the exact day.
Yes.
A significant day in your life. What led to this diagnosis?
I took fecal, it's called coloscan, and that was during a regular visit for Health Pass.
Oh, okay.
Yeah.
Okay.
And so it was positive, and they asked me to do it one more time with my internist, and that was positive too. So I was asked to take the colonoscopy and the endoscopy.
Okay.
And that's when they detected the mass.
The colon cancer.
Well, yeah. Then I took a biopsy.
Of that colon cancer.
And that was, yeah.
On the colonoscopy.
Yes, that colonoscopy said that it was cancerous.
Okay.
So that's why I had to go through surgery.
Linda, most colon cancers are in the descending colon or closer to the rectum. Yours was found in the ascending colon,
right,
farther away from the rectum, which is fairly unusual.
Yeah, it was right between the small intestines and the large
intestines. Okay. All right. So, Linda, we have a picture of your cancer. So we're going to show it for people. So if you are squeamish, you might not want to look at the TV set right now, but this was done on the colonoscopy. So a nice picture of the tumor in the colon. So do you recall how big that tumor was?
It's the size of a donut.
Okay.
And in the records it says it's 6 centimeters.
All right. So 6 centimeters, probably equivalent to about 2.5 to 3 inches in length. So a fairly large tumor. But your colon cancer was stage 3.
Yes.
Right.
Because it involved one
lymph node. All right. So the diagnosis of colon cancer for you was fairly unusual. because of certain lifestyle factors, right, that you had incorporated in the past. Would you care to explain why developing colon cancer was a little bit unusual for you? But then again, also some past medical history things, maybe not so unusual.
Yes. I mean, in about 10 years ago, I changed to a vegan diet, but prior to that, in my youth, I was highly constipated. In my 20s, I suffered with tiredness, depression, crying spells, but basically I got over that in the 90s when I changed to a vegan diet.
Okay, so the vegan diet helped you with your constipation, but also your energy and your mood.
Right.
Okay.
I continued to have biopsies for, I think right now I have a total of 5, and I've seen previous naturopaths, and they've given me supplements, but since this 2000 I haven't gone to see because I've been feeling wonderful, you know. I've changed out all my albumin,
Okay.
so that's not seeping in my body anymore too.
Okay. So you're saying that when you were feeling ill before, you would see naturopaths.
Yes.
And you were taking a lot of supplements and those kinds of things.
Yes.
But when you switched your diet to a vegan diet, you felt so good.
Yes.
You didn't need to take any more supplements.
No.
Your constipation disappeared. All right. But you developed colon cancer, right? So something caused it, and chronic constipation is probably one of the risk factors of developing colon cancer, because the longer the stool sits in the colon, the more chance that the waste from the stool or the toxins from the stool can maybe make some changes to the cells in the colon.
The doctor remarked that this cancer is very old. It's been there a long time.
Oh, really? So when he said a long time, was that like 10 years or so?
Slow growing.
Yeah, okay. So possibly? All right. So obviously you got hit pretty hard, right, with this news. You have stage 3 colon cancer, and you were eating a really healthy lifestyle for, I don't know, 6 years or 10 years or so. What was recommended by your medical doctors, by the oncologist, for what type of conventional medical treatment you would be receiving?
I had surgery, colectomy, took out the tumor and also about 12 inches of that 4 to 5 feet intestines.
Okay.
And I would go through chemotherapy.
Okay. All right. And did they tell you what your 5-year survival rate would be with conventional medicine?
No one said anything about surviving.
Okay.
Except that the nurses were when I was in therapy at that time, they said that for me to be an outpatient was very unusual, because usually people with cancer stayed in the hospital for like a long period of time.
Okay. So I'm not sure what contributed to that. Could have been your healthier lifestyle, possibly. So they recommended chemotherapy. You had the surgery. What were you thinking at that time?
I can't afford this. Yeah, it's very expensive to have cancer.
Oh yeah. Because you're out of work, I guess, for a while.
Well, that was my work allowed me to keep my job.
Oh really?
Yes,
Okay.
Yes.
All right. It's never convenient, right, if you have cancer. So, but you decided to be a part of a research study. Why did you choose to go about being part of the research study?
Well, for financial reasons. My husband's medical called me up and asked me to partake in a research study because it would be
free of charge.
Yeah, cheaper for them. And so I didn't know better.
Oh, okay.
But one thing was good is that I know two other people, older, one member of the church and another, my sister-in-law. They
Okay.
both had colon cancer
Mhm.
and survived it.
Okay.
And so I thought it was just routine.
You thought it was routine?
Yeah.
Did you know what stage of colon cancer they had?
No.
No.
I
Okay.
didn't know about stages.
Stages at that time. So yeah, that's important. Like you probably found out when you came in to see me, and or at least today.
Mhm.
But at that time, you would be given basically a 50% chance of surviving 5 years with conventional medical treatment.
No one told me that at all. Yeah.
Okay. So maybe it was better that no one told you. But the reason why I ask why you decided to be a part of this research study is because the typical treatment for stage 3 colon cancer is you have the cancer resected out or you have the surgery, and then you're given 2 types of chemotherapy medications, 5-FU and leucovorin, and typically you get a 50% chance of surviving 5 years. But then you joined this research study, and in this research study you were taking 6 chemotherapy medications. In hindsight, do you have any thoughts on that?
Well, it pays to research, and I didn't do that. I
Okay.
didn't do my homework. I was too busy with all the activities that I was involved in
Mhm.
because I was working for my master's. My daughter was in school
Yeah.
on the East Coast. She was calling me up, and I was going to work, and
Right.
I grew.
But also though, you have no medical background, so you have no clue, right? But also, I guess being a part of the research study would save your insurance company a lot of money, because most times when you become a part of the research study, the treatment is free of charge, basically.
Right. I'm all heart. I believe. Believe you, anybody who says something.
Oh, really? Okay.
Oh.
But anyway, like anyone who has undergone chemotherapy because they had cancer, it's pretty rough on them. Yeah.
Mm-hmm.
But and that's the typical normal treatment, which is usually involving maybe 2 or 3 chemotherapy type medications. But in this research study, you ended up in a group that was taking 6, right? So we'll go over which medications those are, but jumping from 2 or 3 chemotherapy medications to 6, you're talking about really strong, heavy dosages of chemical toxins or poisons. And typically, we're going to maybe see some side effects happen, and that's kind of what happened with you. So stay tuned, because we're going to talk about the side effects that happened to Linda, which were very horrific, and you battled because you suffered quite hard, right, with the side effects from the chemo. But basically, I guess in general, the research study was done because they wanted to see, or actually the drug company wanted to see, if they added this combination of medications, if it would have a better outcome for people who had stage 3 colon cancer.
Yes.
So the medications was also 5-FU, oxaliplatin, leucovorin, Erbitux, Xeloda, Eloxatin, and Campostar. So you were taking 6 chemotherapy medications. Actually, a few of them are monoclonal antibody medication. When you were part of the study, how long was the research study, or how many treatments of chemotherapy would you have to undergo?
I undertook 24 weeks of chemotherapy, and it was in 2-week cycle.
Okay. When did you start your chemotherapy medications?
Actually, it was 4 weeks after my surgery.
Okay.
Yeah.
So probably sometime in late December, maybe early January.
My surgery was on November the 30th, and
Okay.
I started in January.
Okay, early January. All right. Why did you seek out naturopathic medical care in December of 2006?
My chiropractor, Dr. Ryder, his wife is a patient of yours, and he recommended that I go to see you because she, he wanted me to have what she experienced when she went through chemotherapy.
Yeah, so she did have cancer also?
Yes.
A different type though.
Yes.
But she is doing well today, and she was diagnosed a few years before you.
Yes, she wasn't my advisor because she didn't know all what she told me, so she had to restart her chemotherapy, and she didn't want me to do that.
I see.
So, she told me to start with you first so that I would have a built-up immune system.
All right, okay. So that was the main reason why I guess you came in to see me. You wanted to strengthen your immune system before you started the chemo. Did you know anything about naturopathic medicine at that time? It sounds like it.
Yes.
Yeah, because you've seen a few other naturopaths before.
And they've helped me tremendously.
All right.
I thought I didn't need one after this because I thought, my problems went away. But I am very, very thankful. And you stood by me all the time. Even now, 5 years after, it's 4.5 years after.
I'm glad you're still here, though. But we'll talk about what you mean by, standing by you. Mainly because you were taking 6 types of chemotherapy medications. And when I heard this, when you came in to see me and you told me you were going to be part of this study, I knew it was going to be pretty hard on you, and you found out, what happens when you take a lot of toxic medications or chemotherapy drugs. Would you tell us how you responded to the combination of the 6 chemotherapy medications that you were taking? You had a bunch of symptoms. Let me just read them off then for the viewing audience. So you suffered from nausea, right? So a lot of people have had nausea before, right? But they might have nausea for a few minutes or maybe a few hours. But your nausea was severe. I mean, this is severe nausea that just never went away, right? So I'm going to have you explain how you felt the nausea, as well as the vomiting, diarrhea. And then after the chronic diarrhea ended, you became severely constipated. You suffered from severe abdominal pain. You had blood in your stools. Because of the diarrhea and the constipation, you developed hemorrhoids. You had eczema develop in your body. You suffered from severe acne, like as if you were adolescent again. You had increased frequency of urination. You were coughing up blood. You had ulcers developed in your mouth, your stomach, in your intestines. Your tongue was red and raw, right? It was getting burnt, basically. Your skin was severely dry to the face and lips. You had cracks and fissures to your fingertips. You were exhausted, obviously. You had poor appetite, obviously, because you were so nauseated. And you had retinal calcification that developed. Obviously, you weren't feeling well, so you probably weren't sleeping very well. You suffered from insomnia. You had severe numbness and tingling to your fingers and hands, as well as your feet and toes, as well as pain. And you had increased pigment to your skin, so your skin was turning dark, right, and getting thicker, and you suffered from a lot of cold sores. All right, so I'm going to ask you to kind of just talk about how you suffered with the nausea and the vomiting and the diarrhea. I mean, explain to the audience, how you suffered day in and day out with this thing. And it wasn't just for like a day or two where it was kind of ongoing. Go ahead, Linda, sorry.
Well, all of what you said is true. It was, I'm going to cry. I have tissue. just makes me remember all what I went through.
Yeah, I understand though.
Well, I can remember just throwing out and it was hard. I mean, I had the problems. People would call me up and want to talk to me, and I couldn't. And they don't know that I had sores all over my mouth.
Mm-hmm.
And I was wearing a pump sometimes, you know.
Pumping in the medication?
Yeah, it was very hard.
Mm-hmm.
And I could throw up in front of anybody. Like, I would throw up like 5 times, carry the bag around.
Mm-hmm.
It's very, very...
The diarrhea?
Yeah.
Urgent?
Yes, I would, you know, run to the toilet all the time.
How long did this go on for you?
Well, the thing is, Dr. Gita, I went to see you in December, and you told me to come to see you 2 weeks after I started chemotherapy. So, you know, instead of thinking when I started all this and suffering really bad to go and see you, I waited, you know, a couple of weeks because that's when you wanted to see me.
Mm.
And as soon as I went to see you and you told me, oh, you know, you shouldn't take all of this, or the one in the book that they recommended me to do. You should take fresh juices and raw foods, and you basically changed my diet.
Mm-hmm.
Well, you told me to take the supplements and to, you know, I read the foods to avoid, the foods that I could eat, but when I went and to conventional medicine and they said do this, I followed. You know, I kind of like was trying to do both of them,
mm-hmm.
but when I went to see you and you healed, you know, the diarrhea and the cracks and everything, and I just I kind of like believe more. I wasn't totally sold, I'm sorry to say, you know, because I was still taking the chemotherapy,
mm-hmm.
and I don't know, it wasn't good.
So when you would come in to see me, and you were telling me that you were suffering from all these symptoms, then we would try to we would correct these problems for you. We would change supplements or do this or do that to try to correct the problems that the chemotherapy was causing. Would you explain, obviously a lot of people will understand how you have blood in your stools because of the chronic diarrhea or the constipation, as well as the hemorrhoids, but could you explain how it felt to have those sores in your mouth? Because, you know, that has to be painful.
Yes, I mean, I just didn't talk. I mean, it was, I spent a lot of time alone reading and all,
mm-hmm.
and I'm not one to really express or complain about how I felt. My father-in-law was at home, and he was alive at that time, and he was in his 90s, and so my husband was his caregiver too.
Mm-hmm.
So having me, a cancer person, and him, it was a highly stressful situation.
Mm-hmm.
And so it was.
So your husband was doing a lot of work,
right,
obviously,
right.
helping his father as well as you, because you were suffering and you were in a lot of pain, and you weren't feeling well, obviously. So can you tell us about you know, how the cracks and the fissures in your fingers looked and felt, and how it affected your life?
Oh, they were huge. The cracks in my fingers were on the side of my thumb and my forefinger, so I wore gloves.
Mm-hmm.
And the sores in my mouth, I couldn't touch cold, you know, so getting food out of the refrigerator or eating cold food, I had to stay away from that. Even today, you know, I don't like to drink cold water or ice in my meals or anything. And everything was painful.
Yeah, every part of your body was hurting. Right. So I could understand that. I mean,
Mhm.
and when your tongue actually started to look different, right? It was red.
Right, I had
And
cracks
raw
on the side of my
of your-
mouth. My nose is huge.
Mm-hmm.
So,
What were you feeling during this time? I mean, you were going through your treatment to cure cancer, and then you were suffering tremendously. I mean, basically every part of your body hurt, and you were having things that happened to your body that never happened before. What were you thinking at this time?
well, I kind of knew that I would get over it because, you know, I've really suffered before because I was on tranquilizers, and some of these tranquilizers are horrible that I would crawl on the floor, you know, and just my mouth would be really, really dry. And so, you know, that passed. And so, throwing out, I used to throw out before, you know.
When you were younger?
No, when I was getting treatment for, actually it was a chemical imbalance that I had.
Okay, I see what you mean.
And so my other naturopath gave me things to take, and I would be emptying my stomach too. I mean, I was...
So you've experienced some symptoms like that
you
before.
You wouldn't believe it, yeah.
Mm-hmm.
I mean, when I was in grad school, which I dropped out in the 70s, I went 2 weeks without sleeping, and I would get shocked just touching all the doors, you know. And it was horrible, horrible. And this was just another nightmare.
Yeah.
And so, you know, one thing after another.
Right.
What else is next?
Right. Okay.
I don't know different.
So, I guess you said it well when you said, here's another nightmare. So it was a nightmarish experience for you.
Mm-hmm.
Tell us how you were doing with the naturopathic medical treatment during this time. You know, what were you eating? What were you drinking? Right, because that's important too.
Well, after I came back to see you, I didn't know what to say because I was kind of like throwing myself there, and I don't know if you knew what colon cancer was and all that, but I knew that I had this the reading of the blood tests, and so I didn't know what to do. So we went over that, and when we went over that, and you would say, you know,
your laboratory findings on the blood test.
Right.
Okay.
You're not exercising enough. So that's when I exercised enough, and he said, you know, the blood test was always like the white blood cells, the red blood cells count, and you know, it was abnormal.
Right. They were always really low because of the chemotherapy medications.
Right.
Yeah.
So I was trying to boost that, and so it was with the juicing that I had. I was juicing, but you told me to do 24 ounces of juice and
fresh vegetable or fruit juice.
And then smoothies. I made smoothies, and so I felt really good. I felt relief when I took that. And so there was some kind of comfort that I felt when I did your diet.
Okay.
It was tremendous. And the supplements before, you know, sometimes it kind of like soothed everything out and made it more comfortable. Because I keep a diary, and in the beginning it was like all of these bad things, and then after I started to see you and you saw me and talked about nutrition and vitality all the time, it wasn't just, you know, destroying cells or, you know, hard treatment. It was good things. It was fun. It was, you know, what else can you eat? And, you know, suggesting pumpkin, raw pumpkin even. I said, oh, okay. And it was fun going to the store and looking for more stuff to eat.
That could help you.
Yes.
And I'm glad that, you know, you were feeling better, you know, from the diet change and the juicing and taking the supplements. So your symptoms were starting to get better, right, over time. You were also drinking about 8 ounces of a smoothie a day, fresh fruit smoothies.
Mm-hmm.
How did that taste to you?
It was wonderful.
I'm sure it
yeah,
did.
the apples and everything.
All right.
Fruit, pears. I was buying the big containers and making all those smoothies, yeah. But when I went back to work, I had to go and buy the jambas.
Mm-hmm. Because you couldn't.
You're right, I couldn't because it took a long time, the carrot
Right.
juice and the wheatgrass and all. And so, but right now I'm back to making my own carrot juice.
Carrot
and all.
juice, very good.
Yeah.
All right.
The cost is listen. It's very, very good.
Yeah, yeah.
It's a treat. You know. Even my husband now takes carrot juice too, so.
All right.
It's really good.
Yeah. Maybe we can talk a little bit about your husband later. Toward the end of the program, though, and you can share a little bit about what he's experiencing with naturopathic medicine. But you were taking some supplements. Basically, the supplements that we gave Linda was to, one, try to protect her body, the intestines, because the intestines is very important in digesting food. So the chemotherapy was destroying the digestive tract, causing the nausea, the diarrhea, and then obviously the hemorrhoids and things that come after that. And we were protecting your liver and your kidneys because obviously they're going to suffer from the chemotherapy drugs, because these are toxic medications that your liver and kidney have to filter out of the body over time, as well as then strengthening your immune system, trying to keep your immune system strong so that the white blood cell count or the white blood cells that your body was making wasn't going down too low. And the diet, though, is very important because that's the foundation to our health, right? So not only to prevent disease, but also to help fight disease or cancer. So you were eating more fresh fruits and vegetables, whether it was eating them or juicing them. So because you were having difficulty with the ulcers in your mouth and your esophagus and stomach, we were trying to get you to juice more to get the nutrients from that.
And I take good notes. Like I put down, like if I have to go bathroom like 5 times, I wrote all the times down and all the times I have to. So, you know, I've got pages and pages. I had forgotten all of these symptoms, but going back and reviewing my diaries, it was horrible.
Yeah.
Horrible.
Yes, so it's funny how, you know, you were living that nightmare, right, for many weeks, if not like 6 months or around there, and how quickly you can forget that you suffered from these symptoms after just literally not having these symptoms for a month or 3. But, you know, that's very good. You took a lot of good notes, which can refresh your memory. So, yeah, we're not joking when we're saying that Linda suffered from all of these symptoms. I mean, it was a horrific nightmare.
Yes, plus my daughter was in her senior year, ready to graduate.
In college?
In college, and so she was going through stress, and she added to the stress I was going through, so
It wasn't a great time for your family.
And I chose not to go to her graduation.
Because you were feeling so ill?
Yeah, and my sisters went for me.
Oh?
And so that was a relief.
Yeah,
you know,
yeah.
A blessing.
All right. Tell us how you were able to complete the 6 or 7 months of chemotherapy and while suffering from all these symptoms. I mean, you know, what made you do it? I mean, you completed your trial. You went through the 6 months of chemo, even though you're suffering from a lot of these symptoms.
Yes. I did it because they told me that this is what it took, you know. They told me it was 24 weeks and I was going to put in my time and do the 24 weeks. And my husband was there all the time, and he made it like was a few trip, you know, like. And so when we went down there, he came with me and he brought me that bento, and that was very soothing during the chemotherapy. I think that really helped too, you know. And so we tried to have a good time, and then as soon as we finished chemotherapy, we went out to the restaurant and eat, you know, because
celebration.
Right, we didn't know if this was the end, but we try to make the best of it.
Yeah, yeah. So Linda, obviously you're a tough lady. I mean, you've just powered through. I see a lot of people who have cancer, not like an oncologist would. They probably see, 20 or 30 new patients who have cancer every day. I maybe see a new cancer patient or two every week. But a lot of them I hear, they may have stopped their chemotherapy treatment because they were suffering from a lot of side effects. But you stuck it out. I mean, maybe their side effects were the nausea and the vomiting and that kind of thing, and that was horrific enough for them, and they chose to stop chemo. But you just powered right through, so you can tolerate a lot of pain.
Well, my chiropractor's wife finished too, so I wanted to finish.
Oh, okay. So you had some people that kind of, I guess, encouraged you, or who were like role models for you. All right. One symptom I don't want to forget is you suffered from severe neuropathy, or nerve pain, right, or nerve damage. So you had pain in your fingers and hands and feet and toes, which is a side effect from the chemotherapy. I see patients who have cancer. I'm not going to say many, but there's a few of them who do suffer from nerve damage, and they have the numbness, tingling, and pain in their fingers, toes, or hands and feet. And the neurologist and the oncologist typically tell them that that's really rare that happens. But I've seen it enough to know that it's not really uncommon. What are your thoughts on your neuropathy?
Oh, it's horrible. Like, I lost all control of my feet using a cane. I couldn't get off of the bed. And then I got better. And then I couldn't lift up my hand. I lost this side. I was a rotary cuff, so I went for physical therapy. And the therapist was wonderful, and she helped me through the exercises. Presently, I have tingling in my hands and my feet. I have like balls of balloons of water pockets in there.
It feels like that.
Right,
yeah.
right.
Can you explain that to the listening audience, how it felt when you were at your worst?
Well, even today, I wear sandals with inserts in them.
Cushions.
Yeah. I forgot what you call them, but I go to the
orthotics.
Orthotics,
okay.
Yeah, from the shoe doctor. He recommends it, so I put it in, and I walk with those not only at work but in the house, and that's very, very helpful because it's for the shape of my foot. Yeah. And so.
But you mentioned that when you had the neuropathy and you lost control of your feet and had difficulty walking, the nerve damage to your feet caused your feet to feel really unusual.
Yeah.
How did that feel? You said it felt like you were walking on balloons, water balloons.
Right. And my feet, they're so numb that I can't figure out which side the slipper is on, or I can't. I have to look, and I can't just put on a shoe.
So it's difficult to you with walking because you might lose your balance because you can't feel the ground.
Right.
Yeah. Okay. So you completed your chemotherapy on July 18th, 2007. So about like 4 years ago now. And then you went back to work full time at that time?
I worked full time.
The whole time, right through?
I took the inventory and helped purchase, doing the ordering and getting the books together for the next school year.
Okay.
I think being that I was busy at work, that
helped you.
Yeah, keeping busy. Even if I was sore and all, I just kept pushing away and trying to get the tasks done, because they were paying me. I was getting full salary.
Yeah. So yeah, they expected you to work, but
well, I don't know.
That's amazing though that you were able to work.
Had a friend who continued to be a librarian also.
Okay.
Doing her her sickness
Cancer
was
treatment?
Cancer treatment, and she has since died, but she encouraged me to keep working because she kept working.
Okay.
And so
And that was a good thing.
that was,
Yeah.
keep me busy, keep my mind,
Yeah, I
thinking
mean-
that I'm getting paid, I gotta go work.
So, as I said earlier, it's incredible that you are suffering from all these symptoms, but yet you still worked full time. You know, a lot of people, I don't think, in fact, most people probably wouldn't be able to do it. All right. Why do you think you improved from the side effects so quickly? Because typically, soon after you finish chemo, a lot of your side effects were disappearing already.
I have to say that it's the grace of God and all the people around encouraging me, making sure that I was on task, doing my exercising, eating the right foods, taking my supplements, having a good attitude, praying for me. I mean, I had like, a dozen churches praying for me, and it was, everybody. Dr. Chidi, you've been a great help for me. Continued to encourage me, ask me what I ate. I mean, who would want to know what I eat for breakfast, lunch, and dinner all the time?
All the time you come in.
Yeah. And so that's so personal, and I appreciate you caring so much.
Mm-hmm. Yeah, we need to make sure that you're on track with your health, because, I feel kind of responsible, right, to get you through this. You had mentioned that it was helpful going through your laboratory tests. Can you explain to the viewing audience why that would be helpful for you?
My laboratory tests?
When we went over it together.
Oh, yeah. I mean, I would have readouts because every other week I went to the doctor and we took blood tests, and he would give me a sheet of paper, but I didn't know what it meant, and he was such a busy doctor, very smart. And so I would bring you this paper, and I said, how did, every week, how did it compare? And you would explain to me what it was first, because I have no medical background, and all the how the blood is reading, and the urine, and all exercises, how much oxygen in the blood, and
right, because we do know how much oxygen is in your blood by looking at the carbon dioxide levels. So oxygen and carbon dioxide are antagonists, basically. So the more carbon dioxide you have in your blood, the less oxygen. So that's how we could tell those things, as well as seeing how well your liver was functioning, right, with the BUN and the creatinine and the GFR. So I guess going over those things helped you understand at that time how your body was responding to the treatment, and that was helpful.
Right. Especially, I wanted to know about my blood because when I first started, I had a carcinogen level of 11, and it's down, and I'm a non-smoker, and so it's supposed to be between 1 and 3, and a healthy smoker is supposed to be between 1 and 5, but mine was 11.
The CEA
yes.
test, yeah.
So, for me to know more about it was very important.
It can be helpful, right? Because you can use it not only to understand your situation, but you can use it to help you with maybe altering or following through with the treatment recommendations at that time. I wanted to also talk about, you had mentioned that I stood by you during your treatment. I guess the audience kind of understands what you meant now, that every time you would come in for your visit, once a month or once every 6 weeks or so, we'd go over your laboratory tests. We would change maybe the treatment a little bit depending on which symptoms were worse or not. And it took time to do that. But you also told me earlier that when you would go in for your conventional medical treatment, you basically didn't see your doctor. It was the nurses who were in charge of your treatment.
Yes. The oncologist tweaked how much drugs that I needed. It was
according to your lab test.
Right, and the times I went in there, from 9 o'clock to 3 o'clock on one of the weeks, it was the nurses that inserted the IVs and came and helped me, and then the following week they would take the the pump and
Mm-hmm.
add more of it. And
Mm-hmm.
so
you really talk to your medical doctor?
every other week. He's the one who made the decisions, but the nurses carried on.
Okay.
And it was very well organized, you know.
Okay. They must have been concerned about the symptoms that you were suffering from. Did they ask you about the side effects that you were experiencing?
Yes. You know, it wasn't where you understood everything and said, okay, try this, try that. As soon as you say, oh, if I say I have cracks in my hand or something, okay, go to the dermatologist. Oh, I don't feel well or something, then okay, we'll send you to the psychologist. And then something else, then we'll go somewhere else. So, you know, I saw a number of doctors. For every symptom that I had, they have a
doctor for you.
Right.
So you were seeing a lot of doctors at that time.
I did go to see.
Yeah. All right. So, you know, obviously, Linda, you're still here. It's close to 5 years after your diagnosis, if not 5 years after your diagnosis. Close to that. Tell us how you're doing now.
I am very grateful, thankful. This is a good, what do you call that, evaluation, flashback of what has happened and what I went through, and right now I'm really grateful for all of the radio programs that every week it was like I went to the doctor, because we religiously listened to you talk and about people getting well. So, you know, I went to the doctor every week because on Sunday nights I was there listening to the radio.
All right.
And
excuse me, I just want to mention to the viewing audience what you're talking about. I used to have a weekly radio program that ran on Sunday nights that anyone could tune into, but Linda would, and you and your husband would tune in and listen to the program, and probably every 4 or 6 weeks or so I'd have a patient coming on the program sharing their story just like you are, but on radio as opposed to television, and how, you know, what disease they suffered from, how bad they were, and the recovery. So it was comforting for you to listen to those shows.
So presently I just suffer from the numbness and the tingling in the feet, and I have some calcification in my eyes, and if I don't do my exercises I get pain in my body, so I know I need to aerate my blood or put oxygen in my blood, and so it's very important that in the morning I get up and I do my routine, and at night I try to do my routine again, the exercise routine. That's very important for me to unplug my nose and my mouth and all that mucus that still comes out and all.
All side effects from the chemotherapy?
Well, I didn't notice before, but now it's like I can't sleep. I have to get up. You know.
You never had it before you started chemo. All right.
I didn't notice.
And you don't have any cancer in your body anymore?
Well, I don't know.
According to the last MRI that was done.
Right.
Yeah.
Right.
When was the last MRI that was performed on you?
Well, I think it was like 1 year afterward. I'm not sure when I took it, because the cancer program that I was in, I dropped out of that program after a year or so, because I didn't want to submit to any more tests, routine tests, because I didn't see any need to it. And
I see.
More, radiation would just get me more sick, so I didn't want any more. I had enough.
Okay. And you mean like an MRI or a CT scan?
Right.
So you didn't want to subject yourself to that kind of radiation, not radiation treatment for cancer.
Right.
Okay.
Yeah.
So, but you did complete your course of chemotherapy.
Right.
But you didn't follow through with following, I guess, another 5 years.
Right.
But would you also tell the audience what happened to that study?
Well, let me just say that I did participate in the follow-up for maybe a year.
Okay.
But then I didn't want to do it anymore. But I just, in December 14th of 2009, I received a letter saying
over a year ago, anyway.
That they no longer have that study group. Yeah.
They ended the study. Did they kind of mention why?
In fact, I have this letter
you
over
have the
here.
Letter?
Right here, it says that based on early review of the results by the Data Monitoring Committee, it has been determined that additional cetuximab to Foflux is of no benefit. In a careful and detailed review, the DMC determined that in this clinical group, no group of patients benefited from the addition of cetuximab to Foflux. Additionally, there was some initial evidence that addition of cetuximab to Foflux may have been harmful, particularly to patients aged 70 and older.
All right.
And I just need to say this, that I'm not against conventional medicine, because I believe that doctors need to practice for emergency situations. They need to keep their skills, really well, and for a lot of people, they need immediate help.
Mm-hmm.
So, but on a long run, in a preventive manner, I think that people shouldn't just run to the doctor and get a pill for this and that. They should practice good eating, and cook their own, not eat junk food, not eat all these sugars and all.
Mm-hmm.
So I'm not against studies and all. I really believe that people need to help each other, and if this is the way that they think works, well, I just pray that they know what they're doing. But I believe everybody, but I'm just trying to gravitate to the ones that help me the most.
I hope I'm one of them. So you believe that more people should take care of themselves,
yes.
Eat well, exercise.
Mm-hmm.
Eating well meaning more fruits and vegetables, avoid the sugars and those kinds of foods.
Mm-hmm.
But I guess in summary, the research study was ended because one, there was no benefit according to the statistics, but two, more people were probably dying from the higher dosages of the medications, especially people who are older. And at that time, you weren't 70 years old.
Right.
And you're not that old.
Actually, their intent was good. They were giving stage 4 cancer treatment to stage 3 people, because they found that after the people with stage 3, after 3 years, the cancer would return. So they're trying to avoid that.
Mm-hmm.
But more people died,
right.
with
the additional chemotherapy
right.
medications.
So, yeah.
All right, Linda. I'm just happy for you, and that's
right.
why I'm smiling and laughing. But
grateful.
In hindsight, what do you think about? Would you ever go through that research study again, and take the 6 chemotherapy medications again?
No,
you wouldn't.
I wouldn't do that. I don't recommend it. If I got cancer again, I would try to just do the natural way. And I hope I don't get. I mean, I think my downfall is exercise. I need to put more oxygen in my blood.
Mm-hmm.
And because your diet, your supplementation, is excellent, and I think that they cut out most of the bad stuff, and I just hope I don't grow anything else.
Well, so far so good, but only time will tell. Yeah, obviously. But you suffered so much, right, from the treatment. But the bottom line is you're still here, right?
Yeah.
But still, you think you would not take the chemo next time around because it was just so hard on your body.
Right. I think God isn't done with me. There's something more, and maybe if this is the way that I teach, maybe this is why I'm here. to tell everyone that you have to eat good, be healthy, exercise.
Well, hopefully there's
See,
enough
doctor.
people who watch this program on Olelo and can take to heart, your journey that you went through with battling your colon cancer. Linda, how do you feel about naturopathic medicine now?
I always believed in naturopathic medicine. It's an extra cost besides regular medical insurance. So I just pray that everyone would have an opportunity to take advantage of naturopathic medicine.
Mm-hmm. Yeah, and that's the tough part, right? Because it isn't covered by most primary medical insurance companies. But so it does cost to see a naturopath, but you found it a benefit for you, even though you had to pay out of your own pocket.
Well, most of the time, except I was standing in the back of one of your patients, and she was talking, and I found out that my husband's medical covered was included. I don't know if they just changed it recently, but I have some benefits with my husband's insurance plan now, and it is truly
helpful.
A blessing. And we're hoping that my medical insurance would help to relieve.
All right, very good. So yeah, there are some insurance companies that cover naturopathic medicine.
Mm-hmm.
So yes, if you're interested in seeing a naturopathic physician, you want to call your medical insurance provider and ask if naturopathic medicine is covered under your plan. How do you think about how do you think naturopathic medicine helped you in fighting your colon cancer?
Well, your Dr. Uchida, you gave me a cancer treatment plan, and it explained how supplements and diet will eliminate toxins and poisons, and how supplements would build up the immune system and cause good growth, and enzymes that is needed to digest and for the food to assimilate in the body, is just going to be enhanced when you do the right diet, exercise, supplements, and it's a combination. And it's just a caring, home loving program that you can actually go to the store and say, look at that food, or instead of just saying, okay, let's pull up to this fast food center. It really makes you want to be an active participant in the kitchen.
Yeah, and that's key. Yeah, it allows you to be an active participant in your treatment, because otherwise, if you're just going through chemo, you're just there, right? You just present yourself, you get the chemotherapy, but basically nothing else is added. But you found that at least you could help yourself by eating this or avoiding that, drinking these things, and or exercising. All right. What would you like to say to anyone who is suffering from colon cancer?
If you're suffering from colon cancer, I truly believe that you should seek help. And I come to see Dr. Uchida, and he will give you a treatment program, a diet, foods to eat, foods not to eat, and stay away from sugars and refined flour, and actually the body only needs a little bit protein, like 25 grams, and so a lot of just 2 ounces of protein. A lot of people are overtaking the protein, and as it goes into body fat. So if you're doing taking in foods that you're not supposed to, you're growing tissues that is not conducive to vibrant health. So in order to know what to do and how to really get healed, I think you need a good advisor.
Thank you, Linda. All right. Linda, you had mentioned earlier that your husband is also seeing me for naturopathic medicine.
Mm-hmm.
Could you explain what he's experiencing with his treatment?
Well, my husband, Bill, has fungus on his finger, and it was very terrible looking. And so he came in to see you, and you asked him to, well, I don't know exactly what his treatments were, but he's taking supplements, and he's very diligent about it, and he takes every bit of it.
Mm-hmm.
But the benefit is that he doesn't take any sugar, and he follows what you say to the T. So he's off of like all flour and
processed
foods, even more so than I mean, he won't even taste. So in a sense, it's really good to have the whole family involved, because when he shops, sometimes he would bring home goodies.
Oh, okay. Before,
but after he's a patient, he's become a patient of yours. I think since November or so, he's really been helpful. My treatment to me has gotten better because he's involved, and he knows what it is to be healthy, and he will tell everybody, all of his family and mine too, how to stay away from sugars and flours and things that will cause this fungus to grow, and he will advise, and people listen to him too.
Oh, really? Very good. I'm glad it's helping you with your treatment and staying on course with yourself. Your husband had seen me for actually a few things, and warts, as well as lumps in his body and pain in his feet, as well as the fungus. And he had sought conventional medical treatment first for all of these things, and he didn't see any response. But now that he's changed his diet and started taking the supplements, he's much better. All right. Linda, I'm sorry to say our time is up. Linda, thank you so much for joining us on A Little Television. For the viewing audience, we want to congratulate you and wish you continued success with beating colon cancer.
Thank you, Dr. G.
You're welcome. I'd like to thank all of you for tuning in and joining us today. Hope you enjoyed the program and learned something of value. I'd like to invite you to continue to watch A Little Television in the next few months. We have planned a few more very heartwarming, successful stories of patients who are beating incurable or difficult to beat diseases. Our hope is that these stories inspire in you the hope that true health is attainable and you can have it when you're ready. My name is Dr. Jason Uchida. Goodbye.